Hello and welcome to PhysioJo's Health Info. Today we're going to talk about sciatica. The reason why I want to discuss this topic is for the simple fact that a lot of people don't realize that sciatic pain can come from two different areas. So I have quite a few people that come to me and say, hey, you're a physio, can you give me some exercises to help with my sciatic pain? Then my question to them is, okay, is it coming from your back or is it coming from your bum? And a lot of people don't know the difference. They can't really say where it's coming from, and they can't really tell me where they think the cause of it is. So then there comes the need to do an assessment to figure out what the cause is, to have a better prognosis with the exercises. So I like to give exercises knowing what I'm dealing with, knowing what the cause of the problem is. I don't like giving exercises or treating the cause of somebody, or treating the pain itself and the area where the pain is without knowing what the cause is. So we're going to talk about what the different causes of sciatic pain can be. So in general, sciatica means pain along the distribution of the sciatic nerve. Now, the sciatic nerve is a big one. It's a really, really thick nerve. I'll show you a photo in a bit. I have a lot of photos that I've flagged in my anatomy atlas to help you understand what I'm explaining as we go along. So there's two different areas that could be giving you problems and giving you the sciatic pain. One will be right from the spine, specifically would be one of the nerve roots that's exiting the spine that's getting compressed, and another is once the nerve is already formed in the bum, being compressed by a muscle. So let's start off with number one. The way our body works, so I'll show you this one first. So you've got your lumbar spine there, and all those yellow bands or ropes that are coming out is the nerve root that comes out in between each of the vertebrae. We talked about this in the back video. So those are the nerve roots. So roots will come together to form the nerves that end up going in the body. I think I've mentioned before, in your lower back, the nerve roots that come out of there will form the nerves that go into your legs, and the nerve roots that come out of your neck are the ones that go into your arm. So if you look at this next diagram here, they took the backside of the vertebrae off, so you can see the spinal cord coming all the way down, and then all the nerve roots, you can see not just where they come out, but you can actually see where they come down, and they actually form the sciatic nerve that comes down into the back the back of the leg behind your hip. So the sciatic nerve will take its innervation from the nerve roots of L4, L5, S1, S2, and S3. So if any one of those nerve roots is getting compressed, you could have sciatic pain. The most common ones that we see in clinic are L4 and L5, where they come out. So they're going to be compressed. Why? We talked a little bit about this in the back video, is if the space is smaller. So our body's designed to have, for that nerve root to have just enough space to come out of that intervertebral foramen and be able to function, and it will move. It'll come in and out depending on what position our body is in. So it'll get stretched and it'll get slacked. So what can cause pinching of or impingement of that nerve root where it comes out in that space? Well, one is something wrong with the disc. So it can be bulging or it can be herniated where it's sticking out towards the back. So it's decreasing the space of that hole there. Another option or possibility, and mostly with the population that I deal with, which is mostly older adults, a lot of people have degenerative disc disease. So previous injuries to their disc has led to that disc starting to dry out, and it's not as absorbent as it was before. So on an x-ray, we would see that the space between the two bones is much smaller than it used to be. If you decrease this space, it's going to decrease that space there as well. So if you have degenerative disc disease, it is not going to be, the space back here is not going to be as big as it used to. So that's one of the reasons why the nerve root can be getting compressed. And along with that degenerative disc disease often comes osteophytes or bone spurs that set in, whether it be in the front of the facet joint here or back there, which will encroach that space and again be a cause of that nerve root getting compressed. So those are all common reasons for a nerve root to get impinged, and those are some pretty serious causes. Like if you've got degenerative disc disease, unfortunately, there's nothing that can be done to undo that damage. The good thing though is that you can do some exercises and get moving better and align your spine and your body a little bit better to help prevent it from getting any worse. We can't undo the damage, but we can prevent it from getting worse. And what I like to tell people a lot, and I think I may have, sorry if I mentioned this before, is a lot of people have back pain that on an x-ray or on an MRI doesn't really show any degenerative changes, which is awesome. But there are also just as many people that don't have any back pain at all and have had an x-ray done or an MRI, and it shows that there is some degeneration in the spine. However, they don't really have very much back pain. So I don't like to go to decide on my treatment and my protocol of treatment or exercises or even prognosis to a patient when I'm talking to them just based on an x-ray or MRI report. It's great to know what we're dealing with, but I'll never try to predict the outcome or design an exercise program just based on that, because like I said before, a lot of people can be asymptomatic even though they have some positive findings on an x-ray. Okay, so those things you can't change, but like I said, a good exercise program and working on alignment can stop it from getting any worse. Other things that can happen in the back is there's a lot of little muscles. I remember showing you guys the different layers of muscles in the back, the little rotator muscles. There's a bunch of little muscles in there, or even the bunch that come down on either side that could go into spasm, that can get irritated, that can be damaged with a bad twist or a turn. Those muscles can be damaged, they can swell up, and they can compress the nerve root too, right where it comes out, or it can be a little bit further. Like that sciatic nerve is so big and it takes branches from all over the place that there are many possibilities for what's causing it at the level of your back, like in your spine. What you can do, what I want you to remember in terms of if you're thinking, okay, so let's say it is coming from my back, what can I do to help alleviate some of this pain other than exercises that you keep talking about all the time? So some tips that you can do are based on how the body mechanics of the spine when we move. So I'll explain that a bit and then you'll understand why I'm going to give you these next few tips. So if you, I don't know if this photo is going to help me explain it very well, but so there's your space. When you're standing still, this is pretty much what your spine is going to look like. There's contact between these two bones right there, but it's not like a hardcore compact contact, but they're touching. And the discs are nice and comfortable there because let's say you're standing in the best upright position that you can have. As soon as you bend forward, so I would be going this way if I'm bending forward, what's going to happen is if you picture these two bones separating there, you're going to have an opening here. So that space where the nerve root comes out is going to get bigger because you're opening things up. You are gapping the bones here. So the bones that are sitting one on top of the other like that are going to open up like this as you bend forward. So less contact between the facet joints and greater space there as you bend forward. General rule, that's what happens. So your pain could be, you could have localized back pain and the stuff going down your leg, which is the sciatica. If you have that localized back pain and it seems to get worse when you bend backwards, it's probably because those facet joints have been irritated. It could be that you have arthritis in there. It could just be that they're inflamed. Whenever you bend forward, no, I said it opens up. When you bend backwards, it's the opposite. So you're going to have more contact and pressure on those two bones. So theoretically, if you have arthritis or irritation of the facet joints back there, when you bend back, you're going to have more pain. When you bend forward, you're going to have less pain. So remember that when you're doing things. If you're doing something at home and you're like, oh, geez, that really hurts. Try to stop, analyze what you were doing, and if you can figure out what you did just based on what's happening in your spine, then try going in the opposite direction and see if that helps. I'm one of those people that you'll hear me all the time when someone says, when I do this, it hurts. My first response will be, well, don't do that. And sometimes I'm saying it like to get a smile out of the person, but oftentimes I'm serious. If you're doing something that causes pain, you're probably irritating a structure that's been damaged and trying to heal. So avoid doing that until the pain subsides. Then you can slowly try doing it again. If you find something that helps, that makes you feel better, then do it. I had someone, I remember, come to see me. I don't even remember if it was a back or a hip issue, but one of the first things I asked was, okay, what causes your pain? They listed it. What gives you relief? Well, you know what? The only thing that gives me relief is when I lay down in bed. Standing's bad, walking's bad, sitting is bad. So I asked her, okay, so during the day, how often do you lay down to give yourself symptomatic relief? And they said, well, I don't. I only lay down when I go to bed at night. I said, well, you have to start doing that on a regular basis to bring your pain down. You have the answer. You came to me wondering, what can I do to make my pain better? But you already have the answer. So I want you guys to think that way with any of the pain that you have right now, especially when it comes to the back. If you can find the trick and the tip, whatever makes it feel better, use that on a regular basis, the way you would heat, ice, or medication to help decrease your pain. Okay, so that's your basic forward and back position in a nutshell, very simplified. Now we're going to go to opposite sides too, because a lot of people, they'll say bending backwards hurts and also bending to the left. So if it hurts when you bend to the left, picture the same thing with your, so these are the facet joints in the back, okay? So they're sitting like that. When I bend forward, I was telling you that it's gonna open up. When I bend back, it's gonna compress. So now imagine them being on this side here. If I go this way, if I tilt so to your right, my left, if I go that way, what's gonna happen is this one's gonna go up while this one's going down, if we're talking just the top one. So as that happens, you're gonna have a decompression on that side and you're gonna be compressing this side. So if you lean this way and you have more pain, you're compressing the structures on the left-hand side. If you go this way and you have a relief of that pain that's on this side, you're opening up that side. So if you remember, whatever side you're leaning to, you're compressing on that side, you're opening the other one. If you're able to find a position, you could, and I get people try that in the clinic, lean to the left. Does that feel better? Or does it feel worse? The other side, does it feel better, feel worse? If there's a position that feels better and you can relate it to the opening and closing and it matches opening and closing when you're bending forward and bending back, and you can put two and two together that, okay, every time I bend backwards and every time I bend this way, I have more pain. But actually when I bend forward a bit and when I bend to the opposite side, it feels a little bit better. Then you got a couple options there. Either your facet joints are really not liking being compressed, or you already have decreased space there where the nerve root comes out and you're just closing it even more and it doesn't like that. So it could be a combination of that local pain from the facet joint and the nerve root that's getting irritated, making your sciatic pain worse. So in saying that, if you're telling me bending forward feels better and bending to the opposite side feels better, use that as a treatment tool for yourself. Whenever your pain starts to get bad, stop and get into one of those positions to try and bring it down. I'm not saying it's going to make it go away, but if you can bring it down a notch or two on a pain scale, that's bonus. And it's something you can do at home and it's not medication related, which we're always pro for in physio. So in a nutshell, that's what's happening in the back. Now, let's go to option 2. And this is what we call, what a lot of people call is Piriformis Syndrome. So let me find the piriformis muscle here so I can show you where it is, what it looks like, what it does in life, what its job is. Actually, before I go there, I want to show you this. Oh, you know what? Oh, yeah, there it is. So this is just a diagram that I had flagged, and it'll just to show you the size of the sciatic nerve. That's where it is behind. So you're looking at the hip from the front. So there's your iliac bone, there's your femur coming in to form your hip joint. So here are L3, 2, 1, L5, L4. So these 5 guys will come together to form the sciatic nerve back here. Okay, now if we look at, now that's just the nerve and the bone, quite simple. Our body's a lot more complicated than that. Let's flip back to the bum, because that's where it comes out. That's where you're gonna see it. So here's your gluteus maximus, great big bum muscle. Talk about him in a bit because he's usually the culprit, the cause of, not the specific cause, but the looking at the big picture cause of is usually him. So now take off the gluteus maximus and medius, and what do you have? A bunch of little muscles under here, okay? There's your sciatic nerve peeking out in underneath the piriformis muscle. So there is your piriformis muscle, the culprit, the direct culprit, but it's not really his fault. And I'll explain why in a sec. So first off, I'm just gonna say that there's a percentage, I don't remember, I learned it in the university, but I can't remember the exact percentage. My physio friends who may be watching this, let me know if you remember. But there is a percentage of the population that have that sciatic nerve that goes right through the muscle. It splits right through and down it goes. Most of us though have it go underneath the muscle, regardless of whether it's in the muscle, and we would never know. There's no testing that they'll never do any kind of diagnostic testing to tell you that. It's only by dissection that we would find that out afterwards, and that's not going to be relevant at that point. But either it goes right through or it goes underneath. Regardless of where it is, if your piriformis muscle is in spasm and isn't happy, is pissed off, I like to say, you can compress that nerve very, very easily. So a piriformis muscle that goes into spasm is going to get hard. Now, in university, when we were learning how to palpate all the muscles, that's one of the things our teacher told us. They said, you're not going to be able to feel the piriformis muscle unless it's in spasm. So when you're touching a muscle that's happy and relaxed and has no extra tone or not working too hard, not mad at you for whatever alignment issues you have going on, it's going to feel like raw steak. You push into a raw steak with your finger, you can sink it in quite nicely. It's nice and soft. A muscle that's in tone or has a spasm in it and just doesn't want to relax because it's being overworked and overused feels like a piece of steak that's been very, very well done, hard to the touch. That's what's happening. That's what it's going to feel like in your body. So I've had people say, I've touched my bum and I can actually feel like a bump there, a lump. And then as their symptoms regress and they start to feel better, they're like, you know what? I don't feel that bump anymore. And I myself as a clinician, I test the piriformis muscle all the time. As soon as there's a muscle imbalance in the pelvis, I want to go see what's going on in that piriformis. I'll check the strength check the flexibility of the hamstring, check the strength of the core muscles, check the strength of the gluteus maximus muscle. And if there's weakness in there, for some people, I'd be willing to bet money that their piriformis is not going to be happy and it's going to be in tone. For most people, when I get there and I start to palpate in the back, like it goes from the sacrum to the backside of the femur. So when I'm palpating in there, oftentimes I'll feel the muscle twitch. It'll go into spasm, or it'll get rock hard, even harder than it was before I started palpating it. And those are just signs that your muscle is giving you to say, back off. I'm not happy, I'm being overused, and it's time to stop. This is time to settle down. When it gets to the point where that muscle is rock hard and really, really sore and in spasm all the time, it will compress that sciatic nerve. You're going to have either localized pain there. The localized pain in the bum is often just that muscle that's pissed off. If it's ever associated to pain, numbness, or tingling that's traveling down the back or the side of your leg, then you can pretty much safely say that you have sciatic pain or sciatica. Use whatever term you want. And so with the different testing that we do to see what's happening in the spine with all those movements we talked about, seeing where exactly, if the pain is going down the leg, we can check and see where exactly that pain is going to have an idea of what nerve root's being compressed, because every nerve root is associated to a different patch or area of skin where you're going to feel those symptoms if you're getting compressed up in the nerve root, in the spine. And there are specific muscles that we also test to see if the endurance of that muscle is the same as the other side. If your nerve root is getting pinched, then that muscle is not going to have the same endurance as the other one has. So with repetitive resistance testing, there's going to be definite weakness noted on that side. And then compare. So if you've got those things happening, that's a sure bet that there's something going on in the spine. Now, I've actually seen quite a few people that have both. They have the Piriformis Syndrome and they have nerve roots that are getting compressed higher up, because oftentimes it'll start in the back and then muscle imbalances that set in because of poor alignment and compensations will lead to the gluteus muscle that gets very weak, the core muscles that get very weak, and the piriformis that's compensating by doing the job of the extra job of external rotation that your bum muscle's not doing. So gluteus maximus, super important muscle that does hip extension, brings your leg back, and external rotation. What I see in clinics so frequently is it's not doing its job. Therefore, the hamstring is going to compensate for the hip extension component of what it does, and the piriformis compensates by doing most of the external rotation because gluteus maximus is not doing its job for that. So what can you do to help that pain? I gave you some tips for the other one. Now, tips for this guy. A lot of people give the stretching of the piriformis muscle. I'm gonna discourage you to do that at this point because that muscle is already overworked, overused, and oftentimes in an already elongated position. That stretching it It may feel good when you're doing it, but you're not going to fix the cause of the problem at all. The cause of it, so yeah, specifically it's the piriformis that's in spasm that's compressing the sciatic nerve, but why is the piriformis so mad? Why is it so pissed off? Is because the glute is not doing its job of externally rotating the hip and extending the hip the way it's supposed to. So the piriformis is compensating for that guy there who's been lazy. So settle down the piriformis by waking up your glutes. You got to strengthen your gluteus maximus muscle. That's step one. Strengthen gluteus max so that piriformis can settle down and doesn't have to be so upset and overused all the time. And then your sciatic nerve will not be compressed so much. Fix all of that. Wake up your glute so your piriformis can settle down and your sciatic nerve will no longer be compressed. Pain, numbness, and tingling going down the leg should subside. Now, yeah, you're probably saying, well, yeah, that sounds pretty simple, but I've been to plenty of physios and massage therapists and chiros and whoever, and it's not working for me. There might be something else going on. You may have something going on in the spine and going on in the bum, or it may just not have been addressed in that same fashion, that same order. I believe in alignment first. So let's make sure that your posture is good. That's why I give you guys postural exercises, that video right at the beginning. You can't, in my opinion, it's hard to get anything to stick when we're working on trying to resolve an injury or an issue if you don't have good posture and the proper alignment for all of these new changes in terms of flexibility and strength to actually be set on. So there's a process that we like to go through, that I like to go through anyhow, and I hope you enjoyed this. So that, in a nutshell, give you a little bit of education of sciatica. It could come from two different areas. A couple of tips for in the back to settle down your pain, some tips to settle it down in the bum. And if you're looking for some specific gluteus maximus strengthening exercises that won't piss off your hamstrings or your piriformis even more than they already are, send me a message, an email, call, and I'll run you through it. I'll send you some that I have on paper. I'll send it to you by email. I'll scan and send them to you. I'm at 22 minutes. Time to stop. Too long is not good. But stay safe. Be happy. Keep moving. And pretty soon, hopefully, we'll see, well, not hopefully, eventually, pretty soon, hopefully it'll be pretty soon, we're going to see each other in person and get back on track and get things rolling and continue to have fun. Okay, bye.